My name is Anya Samnani, and I'm a Girl Scout senior. Thank you so much for joining me today for this emergency preparedness workshop. This is a crucial topic that we often overlook, and it is very important that we prepare before it is too late. I chose to discuss this project because of my personal connection with it. My grandparents live with me for most of the year, and I've realized through my time with them that there is a disconnection and lack of awareness in the subject that is especially crucial to have at their age. I decided to research, create, and execute a project in which I educate and prepare not only them, but as many other senior citizens as possible. Without further delay, let us get right into it. First off, fires. The past 5 years, there have been an average of 3,037 fires in California annually, with over 96,585 acres burnt per year. California is #1 in the United States for most fires every year. But what causes these fires? There are numerous causes of fires, including power lines or electrical equipment, sparks from vehicles, campfires, and many more. To prepare for this natural disaster, it is critical that you and the person you are helping prepares an emergency kit. The essentials in this kit are water, food, a flashlight with extra batteries, your cell phone, first aid kit, and medication, but it is recommended that you include personal hygiene items, copies of important documents, extra money, maps, and a change of clothing. Make sure they know your contact information in the case of an emergency. However, this emergency kit will not be useful unless an escape or evacuation plan is also established. Meet with your family and friends and plan out what you or they would do in the case of a fire, from escape routes and meeting places to possible shelters and safe destinations to evacuate to. Make a family communication plan. Help them prepare their homes by checking their smoke alarms every month to bi-monthly and change batteries whenever necessary. Keep vital records and documents like passports, birth certificates, and medical records in a safe place that you can locate easily. Most importantly, make sure that they have a way to stay informed of any potential dangers or risks in the case of a disaster. Note phone numbers of local neighborhood emergency teams and volunteer fire departments. And of course, inform and help as many people as you can. Some tips for an emergency kit and plan are, firstly, to invest in a fireproof safe. It is often difficult to take everything valuable along when evacuating, so all items can be kept safe before evacuation and they will stay intact even if the home is hit. In this technologically advanced day and age, it would also be a good idea to scan all important documents like passports and birth certificates and keep them on folders in their phone. You can even make a physical folder with them and keep this in a place where they can easily grab it before evacuating. If they make an online folder, make sure they also include important links to websites with updates and your contact information. Around 10% of residents stay back and defend their homes even when they are ordered to evacuate. This is very dangerous and often leads to an increased number of injuries and casualties. The best time to evacuate a home or place of residency is when authorities recommend that you do so. Fires spread extremely fast, and by the time they order for you to evacuate, the chances of you being too late are much higher. However, if the authorities have yet to recommend an evacuation of your area, as long as they have not recommended it yet, it is entirely your choice. However, this time should be used to prepare for evacuations because wildfires are unpredictable. Shelter in place and get everything necessary for your safety ready to go. Another way to determine whether or not an evacuation is required is checking fire maps like this one shown on the screen. These maps allow for you to see where the nearest fires are, how much they have been contained, and when the information was last updated. This information is also available on my website, which you can access anytime after this webinar. In the case of an evacuation, clear the area around their home of any flammable materials including sticks and brush, and make sure you recommend them to grab their prepared emergency kit. They should collect all of their valuables and electronics, pets, and all important documents including insurance and passports. If at an assisted living center, follow directions given by staff and medical professionals present and gather all of your and their belongings. Now it is time for them to carry out their predetermined escape plan. Remind them to wear appropriate clothing and try to carpool with others. They should make their way to their designated place of safety, which can possibly be a shelter, family member's home, safe meeting place for all friends and family, or where they are ordered to go based on their situation and location. They must stay calm and never ever go running back into a burning building. If they are in a wheelchair, they must exit their home and signal for help. While it is very, very difficult to stay away from home, uncertain of its state, emphasize that they must only return when the authorities declare that it is safe and the state of emergency has been relieved. If they do not know where to evacuate to, simply search up on Google, evacuation centers near me. Results on Google Maps should come up, and all that needs to be done is to click the nearest open shelter and directions will be provided to them. A notification asking to enable location services will pop up. Click Allow, otherwise Google will not be able to give you directions. If they accidentally click Don't Allow, all you have to do for them is enter their correct address. Make sure they know how to make their way to the evacuation center safely, as there is a very, very high chance that there will be traffic in the state of an emergency. Be cautious and do your best to help others that may need it. When returning home, help them check for gas or chemical leaks or any remaining fires. Shut off damaged electronics, check on your neighbors, and call their family to tell them that they are doing fine. Next, earthquakes. Every year, California experiences around 2 to 3 major earthquakes with a magnitude over 5.5 out of 10. Every 3 minutes, there is an earthquake, but most are so minor that we don't even feel them. California is the second most seismically active state in the United States. This is because of the San Andreas Fault, which extends for 800 miles or 1,200 kilometers right through the state of California. The fault is currently in a critical state and may even crack. Similar to fires, there is a map that can be used to view the most recent earthquakes and their magnitude. Not only will this help with general knowledge, but will also help you predict where possible aftershocks may happen and if you should be worried about your situation. This information is in the left column, and you can check for any part of the world, let alone California. Here is a simple 6-step plan to help you prepare yourself and your loved one or the person you are helping for earthquakes and evacuation. First, check for hazards. Fasten shelves to walls, store breakable items in closed cupboards, and hang heavy items away from beds and chairs. Second, identify safe places. Where would they go when the earthquake starts? Some common places are under a table, desk, or bed. Third, stay informed. Read about what more you can do. The Red Cross has great manuals and safety guides. Inform their grandchildren and children of what you and they learn as well. Next, create a kit. Include the same materials in the kit that would be included in the fire kit. The kit should be ready at all times and portable. Fifth, develop a plan. Where would they go once the earthquake starts? Who would they call for help? If with family, where will they meet them? Last but not least, help your community. Tell their close family and friends of their plan so they know where to find the person you are helping. If an earthquake occurs, follow the steps in this image. As you can see, the common theme between every possible situation is that the person in the diagram is covering their head. The most important thing that you do is cover your head. Make sure you emphasize this with the person you are helping when you remind them what to do. Check if they have any injuries, and if they do, get help. If in a damaged building, make sure they know how to find their way out of safely, but remind them that they must not enter buildings that are already damaged. If a circumstance arises in which they are trapped, teach them to protect themselves from inhaling dust by covering their mouth with a cloth if possible. Once they have made their way to safety, they should tune in to a local news station and execute the plan that you made with them together. Find family and friends and get everyone to safety at a shelter, building that is not damaged, hospital, or any other shelter or predetermined place of safety. Expect aftershocks and move around with caution. Being careful with post-disaster cleanup is very important, and emphasize that they should not attempt to move heavy debris without assistance. If they really want to help, make sure that they wear protective clothing. Upon re-entering their home, they must be very careful and avoid handling broken glass. Make them aware of hanging items that may fall on their head, and check for damage before handling electronics to avoid electrocution. In the case of an aftershock, there are some important things that you and the person you are helping should keep in mind. First, stay calm and stay inside if possible. Assume a safe position as far away from windows and doors as you can. If you are outside, stay in an open area away from power lines and trees or anything else that could potentially fall on you and injure you. Earthquakes are terrible and horrifying experiences, but preparing yourself and others as well, and what to do in the case of one, will decrease yours and others' chances of injury. Natural disasters affect your physical situation tremendously, but in order to save people and evacuate properly, we must discuss mental health and natural disasters. When a natural disaster occurs, it is often difficult to avoid panic. This can cloud a person's judgment, and without any preparation beforehand, can lead to panic attacks and irrational behavior. There are a couple things that you can do to combat this. The first is writing down the phone numbers of loved ones and friends. This way that they will not forget their numbers, including your number, especially when in a stressful situation. Call them if you are worried and let them know of the emergency. They should be able to know and list evacuation centers near them. Identify which one is most suitable of their needs and convenient in terms of their location. Most importantly, they need to make a plan and practice through mock drills monthly, if possible. If this is a bit of a reach given their schedule, try to practice with them at least every 2 to 3 months so that they do not forget the plan when it comes time for them to execute it. This is the biggest factor in reducing the chances of panic. Making a plan like the one on the screen and even writing it down or printing it out will make evacuation and escape much easier for everyone involved in the process. We often think that we will be safe from disaster and that the chances of a disaster reaching us or occurring in our areas is little to none. However, this mindset is often the most dangerous when it comes to natural disasters. Accepting your situation and preparing regardless of the probability of it reaching you will keep you from losing your sanity or cool in an emergency. According to a meta-analysis reported on by PubMed.gov, older adults were 2.11 times more likely to experience PTSD symptoms and 1.73 times more likely to develop adjustment disorder when exposed to natural disasters when compared with younger adults. These are disturbing numbers and show how big the problem is. So this is what you can do to take care of yourself and others. The signs or symptoms of PTSD or post-traumatic stress disorder are recurring flashbacks and memories, avoidance of the subject, negative changes in lifestyle such as mood swings and intense emotional reactions to smallest of events, and insomnia or the inability to sleep. Help is required once the aforementioned symptoms continue for over a month or become increasingly severe. If it is difficult for them to go back to normal or control themselves, you must get them help. Suicidal thoughts are the biggest red flag and show that you need to get them help immediately. If you or the person you are helping are experiencing suicidal thoughts, Call the National Suicide Prevention Hotline at 1-800-273-TALK or 1-800-273-8255. This is a very important number, and you must call it if in a difficult situation. They are here to help you. Making an appointment with their doctor or a mental health specialist is also very crucial. Since we are currently in a pandemic, the best thing to do would be to schedule a video call with them. As always, call 911 or your local emergency number in the case of an emergency. This next topic is a bit more relevant as we are currently experiencing one: pandemics. Pandemics spread like wildfire, and it is imperative that you get ready even when the chances of it spreading to you are slim. But how do you prepare for something as unpredictable as a pandemic? Store extra supplies. Any kit that you would use for any other emergency is more than enough. Make sure you have extras of all of your medication and contact doctors for copies of medical records. Watch the news to stay updated and take all necessary precautions. Make sure they stock up their house with extra necessities, including food and sanitary supplies. Carry sanitizers, and most importantly, wash your hands and remind them to wash their hands. Do not go out if you have even a minor cough or cold. If you are visiting them, make sure that you have taken all of these precautions as well. All these steps will help you and them keep safe, even if the virus has not yet reached your area. It can be hard to tell if you or anyone around you is carrying the virus before they show any symptoms. For you and their health, it is very important that everyone takes these precautions. Senior citizens are a population at risk. Thus, they have to socially isolate themselves to stay safe from viruses. When living alone, mental health deteriorates. Dr. Dilip V. Jesse explains, loneliness rivals smoking and obesity in its impact on shortening longevity. As you can see from this map, California is colored blue, dark blue, meaning it is one of the states with a higher percentage of adults with depression over the age of 50. So how do we prevent this? There are many things that you can do to remind them and even do yourself. These include staying physically active, and if you need to, using indoor fitness tools for walking, like a treadmill. However, the best thing to do is walking outside while wearing a mask. Maybe to improve your mental health, shorten your working time to only 15 minutes a day, and maintain social connections. Call your family daily and see if you can learn how to become active on social media and make new connections online. While watching the news is very, very important, it can negatively affect your mental health. Do not watch too much of the news. Find a new hobby or passion and immerse yourself into it. Join online clubs. There are so many possibilities. These suggestions really make a difference, so make sure that you and the seniors that you help follow them. A few more suggestions include focusing on the positive and practicing healthy coping. If you're feeling angry or sad, vent your feelings into a journal. I know that works for me. Try yoga. If you find yourself or them not being mentally stable, seek help. Call your or their physician and reach out to a mental health specialist. Try online therapy and inform your or their family and friends. Here are some resources that can help you help them. These will all be included in my website, which can, again, be accessed anytime after this webinar. Here are some more resources on where to go in order to obtain resources in the case of a lockdown. These resources are very, very important in order to make the best disaster plan and be as prepared as possible. These manuals are from the Red Cross and the CDC, very credible and very easy to understand. I highly recommend that you check them out. Again, these will be linked on my website. Prepare and educate yourself and others to ensure your safety and happiness. Begin your disaster plan and help others begin their disaster plan. You can even download apps like this emergency preparedness manual. This is the App Store for Apple devices. As you can see in this video, there are so many different options that you can choose from. Upon clicking one, as we do in this one, earthquakes, so many options come up for what you can read. Click that and read about what you can do in order to prepare yourself and others for earthquakes and numerous other natural disasters. While some natural disasters and emergencies on this app are locked, you can always purchase them to learn about them if you want to. Thank you for attending my workshop, and for any questions, please visit my website.